Good evening. My name is Dr. Ahimsa Porter Sumchai, and I am an applicant for the Reliant MD California Physician Supervising position. And I am really excited about the opportunity, and I feel honored to be able to apply for this position. It has requirements and tasks and duties that I have experience in, both in live and telemedicine virtual clinic settings. I am the owner of a practice in San Francisco. We previously had a brick and mortar location in the Arden Arcade area of Sacramento, which is a remote area close to the American River, very beautiful region, but a little inaccessible. And it required that we have both an in-house telemedicine service as well as a statewide service that would allow me to connect with the clinic when I was in San Francisco and to provide services to members statewide. So this is a great experience, and it offers me personally and professionally an opportunity to grow. I wanted to address the question, one of the most important questions that you asked in the interview deals with the differences that you approach a patient in a live versus a virtual setting. And it is very important that physicians, as required by the Medical Board of California and third-party billers, understand that you have to apply the same standards of care in approaching and treating a patient in the live and in the virtual setting. Medicare, for example, requires for billing for a virtual visit that there be two-way video cam connection. So talking to a patient on a computer, I like to jokingly say it's like practicing medicine from the International Space Station. There are invariably connection issues, even if you have services that are very, very secure and HIPAA compliant. So you always have to anticipate connectivity issues. When you're dealing with people who are older or not formally educated or don't have a strong basis of understanding of computer technology, then this can complicate some basic issues with regard to connectivity. But my approach in dealing with the patient in a telemedicine setting is the same approach that I take in dealing with a patient in a live setting. In telemedicine settings, I take additional time to review the patient intake information before I enter the virtual waiting room. There's one thing that I do in telemedicine visits that I don't do when I'm seeing a patient in a live clinic setting. I look at the ID, I look at the driver's license, so I have a visual sense of the person who I'm about to interact with. And that can be very, very important in a telemedicine setting, because when you're looking at someone's name as a patient, you may not automatically get a sense as to even what gender they are. So I always review the intake information before I enter the virtual waiting room. I approach the evaluation again the same way I do in a live setting. I listen, identify what the patient's chief complaints are, I identify what their needs are and what their expectations are. I always try to be compassionate. I am genuinely sympathetic to the needs of patients. Some of my compassion and my sympathy that patients often reference when they review me after a consultation stems from a couple of facts. One, I'm an older physician. I'm 67 years old. Sometimes I look younger than people know or anticipate me to be, but I am a mature physician. In some ways, I'm semi-retired, but I remain active. So I've had an experience. I have a fund of knowledge of medicine that I'm very, very proud of. I have practiced in a number of settings: surgery, emergency medicine, urgent care. In virtual settings, I have worked in the area of genomic medicine most recently. I have authorized durable medical equipment. I've done medical cannabis authorizations. I do authorizations for emotional support animals. In fact, I have a lady on my schedule coming up soon who wants an ESA authorization so she can travel with her cat. And there are other services that I offer via the telemedicine platform. The examination on inspection, you can really get a lot of information when you are encountering a patient, even in a video setting. There's a lot that you can see about a patient just with their posture. I can look and tell if someone has a malalignment of their spine. If someone has a scoliosis, sometimes one side of their back can be asymmetric with regard to the opposite side. I look at their affect. I look at their expression. I look at, their clothing. I get a sense of what their home and living environment is like, and that can be much more valuable in a telemedicine setting than what you can gather in a live setting. You're seeing the person often in their home environment, and that can give you some immediate clues about the things that are important to them. It's possible to do limited examinations, and there is technology these days. I worked as a physician for HealthTap. HealthTap is a global telemedicine platform that allows medical doctors to access health data, including laboratory results, and there are advanced technologies that can allow you to even auscultate a heart. So again, in summary, I just want to say that I attempt to apply a very high standard of care in my dealings with patient. I'm proud to say I'm a UCSF Stanford trained MD with a PhD equivalent, and in addition to that, I have experience in the fitness, health, wellness areas, clinical nutrition, and I've done an enormous amount of work in the last 10 years in the area of telemedicine, including helping to perfect and create telemedicine platforms. I also worked for a telemedicine platform that required that the physician assume responsibility for many of the connectivity issues. So I have learned to troubleshoot hardware and software, and I've learned how to chase patients digitally. I have a hard line telephone. I've got my iPhone here, the computer and email, and sometimes it can take all four modalities to help you connect with the patient. So I hope that I had the opportunity to share with you a little bit of what I think is important. And I want to express again my genuine enthusiasm about the opportunity to work in this position, because I do feel that I'm likely to be one of the better candidates that you will interview. And I hope I get a chance to meet you. So thank you so much. And I am going to complete the interview, and I'm going to be submitting this to you as a video. Have a wonderful evening.